All right, let's come to this. The world is finally recovering from the coronavirus, but are we prepared for the next pandemic? Antimicrobial resistance is causing concern among health experts. Back in 2019, researchers estimated that it caused an estimated 1.27 million deaths, and the World Health Organization declared it as one of the top 10 global public health threats currently facing humanity. Now, this week marks World Antimicrobial Resistance Awareness Week. But to get more insight into this, I'm now joined by Senior Research Officer at the Drug Discovery and Development Center at UCT, Dr. Vinayak Singh. Dr. Singh, thank you so much for your time this morning. I mean, quite concerning to learn about this. Let's talk about how your concern about AMR is so massive that you're saying that it could cause or even maybe trigger the next public health or even the next health crisis if not urgently addressed. Good morning.
Good morning, and thank you for having me here. So because it's Awareness Week, I just want to clarify, when it comes to antimicrobials, actually it covers the antibiotics, antivirals, antifungals, and antiparasitics. Because generally there is a perception whenever it comes to talk about AMR, general public understands only for antibiotic. So there is it's a broad term. And when it comes to urgency, just now you have mentioned about 1.27 million deaths, as have been estimated early this year that occurred in 2019. That is an understatement, actually, because this 1.27 million deaths are only attributed to the bacterial AMR infections, not the antimicrobials as a whole. And if you look at the whole picture, it comes out approximately 4.95 million in 2019. And that's a massive, massive figure, And as we are recovering from COVID, I think, there is an urgent, need to really invest in this field, because as per the estimate, if we really do not be equipped as early as possible, then by 2050, there would be 10 million deaths each year.
Now, Dr. Singh, if I may just jump in there, in the context of what you're speaking about, in making sure that we have more clarity and better understanding of AMR, how significant is the awareness week that you're currently hosting right now, World Antimicrobial Resistance Awareness Week? I understand that it's been running from the 18th and it ends on the 24th of November. How important is it in better understanding and raising awareness around AMR?
This is very crucial, and especially for the general public, because this kind of resistance is not like man-made. It's not like, it is with general public. And this is in the evolution, okay? Everybody wants to evolve. And similarly, microbes wants to evolve, and they deal with various selection pressure. So I think the awareness contributes how we can stop the misuse and overuse, because that triggers the enormous impact of antimicrobial resistance. So I think awareness is crucial.
How can you then further encourage, I suppose, best practices among general public health professionals, as you've just mentioned right now, how important it is to know about AMR, but professional health workers, policymakers, to slow this development and spread of drug-resistant infections?
Yeah, this is a multifactorial approach, It is very difficult to, really define in 2 to 3 minutes. But I think, there should be a proper agenda for each country, because how it works, every country, there are like 196 countries, right? And every single country has their own resistance problems. So not necessarily what we face in South Africa that should be applicable to Kenya, for example, because the resistance profile, the microbial pressure is completely different, right? So I think that the main strategy should be to do proper surveillance, because the surveillance is really, nobody's 100% sure what data is coming out. And this is like, very recent, because the very first WHO surveillance data on antimicrobial resistance was in 2014, which is very recent, actually. Right. So I think there should be a proper surveillance, obviously the education of the people. And then once we have that data, then we can understand the epidemiology, what is contributing to the spread of antimicrobial resistance. And obviously, after that, the next step would be what we can do to solve it. Means I would say, okay, we can go for a quick and accurate diagnosis so that the patient and healthcare worker can stop the misuse and go for the accurate prescription, right? And then obviously the major thing from where I come from, drug discovery, I think we need a massive investment in drug discovery and vaccine research development.